Hey folks, it's Dr. Sam, and I want to welcome you to another EyeClarity podcast. We are at podcast 104, and I want to thank you for joining me today. We're going to get to our questions in a minute. I just want to make a brief announcement. I am offering another online class next Saturday. That's September 12th at 10 a.m. Mountain Time. We'll go for about an hour and 15 minutes. And this is a class where you're going to learn how to take better care of your eyes and vision, your brain health, your neurological health. I'm going to be showing you different practices, protocols. It's going to be very experiential, interactive. Also, I'm going to show you a really cool aromatherapy protocol that you can do that will not only help your eyes, but it'll also boost your lymphatic health, your energy and vitality. So if you want to join me, you can sign up on the link in Instagram on my bio, or also through Facebook on Eventbrite. It should be somewhere there. Or you can just go to my website, www.drsamberne.com, click on the online course, and then it will take you into a place to register. And if you're still having trouble, send us an email at appointments@drsamberne.com, and one of my team members will get you registered. The cost is $33, and you will have access to the video audio recording for 30 days. And you also receive a 20% discount on all my wonderful products, eye drops, vitamins, blue blockers, books. So take advantage. I look forward to seeing you next Saturday. All right, we've got some really interesting questions today. And so I think I'm going to dive right in. Let's get going. The first question is from a lady who's just suffered an optic nerve stroke. Pretty serious. And so if we talk about the optic nerve, and this would apply to anybody who's been diagnosed with glaucoma, who's got inflammation in the optic nerve, or somebody who just does a lot of screen time and is concerned, the optic nerve is the plexus of nerves where it's like a fiber optic pathway that then goes back to the brain. And so the optic nerve is essential for us in terms of utilizing what we call our peripheral vision. And when we have an optic nerve problem, it does begin to affect our peripheral, our side vision. And if for this lady or anybody out there who's suffering that kind of situation, two things you need to do right off the bat. Number one, go to your local ophthalmologist and have him or her do a visual fields assessment, measuring your peripheral vision. And that way we have a baseline on how much vision you have, how much is still working, what's damaged. And so that's a good starting place. The second thing is getting an evaluation on what we call your functional vision. Difference between functional vision and eyesight. So when you go to a doctor and you're sitting in the dark room and he puts up the eye chart and he or she is, asking you to read the chart of letters, that's called sight. It's a static measurement, and it's only one aspect of the dynamic process of what vision is. Vision is how the eyes and the brain and the body work together. And so in functional vision, we're assessing much more than your ability to see the chart. I mean, that's just not going to cut it. So what you're going to ask for is, what's the assessment of my visual tracking, my eye tracking? How well do I move my eyes across a page? 2, eye focus. Can I sustain my focus? Can I shift my focus? What's the state of my focusing ability? Number 3 is my depth perception ability. That's how well the two eyes work together. And then some of the visual cognitive skills. Visual memory is a big one. Our cognitive processing. This usually is something that gets compromised if we've had any kind of a visual deficit, whether it's optic nerve, peripheral vision issue. And so what's happening on a cognitive level? And then last but not least, I think another thing to recognize is your motoring ability. You know, our eyes, these two organs of light, are our GPS system. And basically, we use our eyes to motor through the world. And if there's some optic nerve deficit and we're having a problem with peripheral vision, this is definitely going to affect our balance, our orientation, our relationship to our vestibular system. It could cause things like vertigo, dizziness. So the motor ability, as it affects vision and vice versa, needs to be addressed. And it's probably going to be compromised. All right, once you've got those baselines, the physical eye therapy works really well at re-educating or relearning how to use the eyes and the brain and the body together. Now, there's a form of therapy that within the physical eye therapy called primitive reflex therapy. So the primitive reflexes are these very early infant motor patterns. For those of you out there that either have children with learning problems or children with developmental delays, any OTs out there, physical therapists who work with developmentally delayed, primitive reflexes are these early movement patterns that need to become integrated by about age 2. If they don't integrate fully, they begin to interfere with sensory motor development, fine motor development, cognitive processing. And it's one of the main reasons that a person has difficulty in learning to use their eyes from a functional perspective. Now, why am I bringing up primitive reflexes in young children? Well, the primitive reflexes are part of our survival response. They're governed by the brainstem, which is the part of the brain that talks to us about survival. And if we've suffered stress, trauma, toxicity as an adult, those primitive reflexes resurface and dominate the brain function. And that's the last thing we want to do if we're trying to use higher centers of the brain, our cerebellum and even our prefrontal cortex. So most likely with this optic nerve issue, those primitive reflexes at some level have re-emerged and they're dominating. Now they can be tested, and when they're tested, usually you will see the reflexes are dominating the sensory motor system. So doing some movement patterns that reintegrate your survival motor response, primitive reflexes, is number one on the list. You need to do some primitive reflex reintegration. Number 2, craniosacral therapy. Now again, as a craniotherapist for many years, the primitive reflexes work on the central nervous system, getting that more balanced, but craniosacral not only works on the central nervous system, but it works on something called the fluid body. And if we look at early development, I'm talking prenatal development, birth, the fluid body comes before the nervous system develops. So we have imprints in our nervous system, but before that we have imprints in our fluid body. So if we can create more fluidity, more connection on the cerebral spinal fluid level between the brain and the eyes, this is going to help balance the nervous system, so those primitive reflexes are going to integrate faster. You're going to develop more circulation into the eyes and the brain. And also, what's going to happen is that the person then is going to be freed up to be able to develop better sensory motor control. Okay, so cranial work, primitive reflexes, and then some gentle vision therapy exercises. These would be things that would be visual tracking exercises, visual focus, visual coordination, some of the more cognitive processing things that I recommend. And then, of course, last but not least, we're going to talk about nutrition. So for the optic nerve, a couple things we really need. Omega-3, so important for optic nerve health. Taurine, it's an amino acid. Ginkgo is another herb that's really great for optic nerve health. And then, of course, things like beta carotene or vitamin A, quercetin, bilberry, lutein, zeaxanthin, astaxanthin, the colorful fruits and vegetables, and of course, things like glutathione and your trace minerals. Now, I also think you need to address any inflammation that's going on systemically in your body. So probiotics, prebiotic fiber, and looking at the state of your vascular health just in general. Because if you've had an optic nerve stroke, you need to assess, well, what is my vascular health like and what can I do to enhance it? So I hope that that gives you a framework, a roadmap, and I want to thank you so much for the question. All right, let's go to question 2. And this is from a gal. She says, "Oh, hi, Dr. Byrne. I have reoccurring eyelid cysts. What are your thoughts on the causation?" Well, a cyst on the eyelid is something called a chalazion. It's like a painless bump. It can be swollen, and it usually is a blocked gland, specifically the meibomian gland, which is housed in the upper and lower eyelids, produces the oily part of the tears, very important component of our tears to make sure that the cornea doesn't dry out too quickly or that the tears don't evaporate too quickly. So when you've got this blockage, it is dependent on a couple of things: the size, the location, and if there's some secondary inflammatory causes, something called blepharitis or meibomian gland dysfunction. Lots of people are suffering the inflammation in the eyelids, and some other diseases that kind of relate to chalazions could be things like seborrhea, acne issues, rosacea, and just this chronic malaise of eyelid inflammation. Now, sometimes the chalazion can be on the outside, externally, or it can be internally. Sometimes it will start to occur after a person has been diagnosed with a stye. And the standard approach is either let's watch it using hot compresses, using steroid eye drops and ointment, or getting it surgically removed. So in this particular case, this gal has been following my content for a while, so she wants the natural approaches. So this would include, I would recommend using the MSM eye drops in an eye massage and eye bath at least maybe 4 to 6 times a day. MSM is going to soften up the tissue, moisturize, again, collagen support, inflammation. MSM has been shown to help just create more hydration and moisturization in the eyelids. And then in the evening, you can either do the Eye Bright Tea, this is the compress, or another one we've been doing lately that works really well is something called Go-To Cola combined with mugwort. These are herbal teas that you can buy loosely and create a compress. And again, you can do a warm compress, a cool compress. I like to rock the temperature because sometimes this can move the chalazion into more dilation, and eventually it will just dilate and then go away. You can use a hexane-free castor oil, massaging it into the eyelids. And another go-to that I really like is something called helichrysum hydrosol. So helichrysum is an essential oil that is my number one go-to if you've got a skin issue. As we know, essential oils, especially if they're high quality, organic, they can offer a lot of oxygenation and hydration and push toxins out of the body. Helichrysum, as many of you may know, is one of those oils that helps improve skin health. Now, in the hydrosol, this is the part of the distillation process of the essential oil, where part of it, the water particles combine with the oil, and it creates kind of what we call a spray or a hydrosol that's very safe that you can direct to the eye. So you would be spraying this helichrysum hydrosol into the eyes, eyelids, around the chalazion several times a day. This has been shown to be a great game changer in helping eye health and these congestion issues, especially in the eyelids. So I wish you the best. This is something you've got to stay with. It's not necessarily an easy solution, but if you have patience and you work the process, you have a great chance of avoiding more of the pharmaceutical drugs and or surgery. All right, let's go on to our last question. This is a question that was posed by another follower. She's got a condition called subconjunctival hemorrhage, and this is where those broken blood vessels break on the white part of the eye, and it looks a lot worse than it really is, but it's definitely disconcerting when you get this kind of blood that's on the white part of the eye. So I'm going to point you to a study that was published in 2013 in Clinical Ophthalmology. And in this, the researchers took a look at this particular bleeding situation in the eye. It's again called subconjunctival, which means it's kind of underneath around the eyelids, and blood vessels are breaking on the sclera, which is the white part of the eye. And what they write is that this condition is benign. It's ocular redness, but it's an acute ocular redness. And some of the main reasons why we might develop it would be sneezing, coughing, weightlifting, doing yoga inversions, trauma. In younger people, it can be related to an overuse of wearing contact lenses, and in elderly people, it can be related to more systemic vascular diseases like arterial sclerosis, hypertension, diabetes. So these would be some of the reasons why, if the hemorrhaging is persistent or it occurs frequently. Another thing that's not brought out about this kind of a bleed is it can be caused by pharmaceutical drugs. One drug therapy that's done, interferon, which is used for chronic hepatitis, sometimes that particular therapy can trigger the blood vessels to break. Also, some other side effects could be anticoagulant drugs, antiplatelet therapies like aspirin. So you want to check in with your doctor about what pharmaceutical drugs you may be using for blood pressure, hypertension, arterial sclerosis, and so on. Also, carotid artery disease is another possibility, and even things like ocular tumors can also be part of it. So if you're going to do a more natural approach, I think what I have found that works well would be the MSM drops, maybe every half hour or hour. You could even do every 15 minutes. And you're going to notice that after a few hours that the blood is going to be flushed out of the eye. You could use Similasan eye drops, homeopathic eye drops as well. You could do the Eye Bright tea compress. You could drink the Eye Bright tea. These are all ways to get rid of the congestion in the blood. And, anything that you're doing in terms of lymphatic drainage, craniosacral, gentle exercise, these are all things that can also help accelerate flushing this out of the body and out of the eye. If it is recurrent, I would definitely check in with a naturopathic doctor, functional medicine doctor, and check in with your vascular health, because there can be a correlation there to subconjunctival hemorrhages and vascular disease. So I want to thank you for the question. That's great. Well, everybody, I think I'm going to call it a day. I want to thank you so much for tuning in. Keep sending me your questions, and I look forward to our next telecast. And until then, take good care.